Wait a few minutes before everyone logs on and wait for all our friends from different parts of the world to show up and join this conversation again. In the meantime, it's just a pleasure, Pamela, to be seeing you once again. We've known each other for so long, and as anyone joining us to, in the next few minutes will know, Pamela just reminded me that we've known each other for almost 8 years. Actually, maybe even a little longer than that, I think.
Probably longer, yep.
Yeah, which seems like 2 minutes ago. It's crazy. Anyway, first of all, Pamela, I just want to welcome you to Change, and everyone else to Change for Good. It's Thursday, it's July 17th, it's 11 o'clock, it's here in Toronto. Used to start out these Change for Good conversations saying, well, this is the first week of Change for Good, or we've been home for 2 weeks and 3 weeks and 4 weeks, and it's clear that doesn't matter anymore. So we're all here at home though, and it's a great pleasure to be having these conversations with people like Pamela every week. Pamela is I should say your full name actually, because I don't know. Pamela Fuselli is the president and CEO of Parachute Canada, which is the leading organization in Canada that focuses on the important issue of injury prevention. And you, Pamela, have had years and years of experience in this space, and also in healthcare, injury prevention, policy development, and so on. It's a super great pleasure to be speaking with you today, as always.
I'm very excited to be here. Thanks for inviting me.
Yeah, it's a pleasure. And so we were just reminding ourselves, I asked Pamela a little while ago, how long we know each other, 8 years. We got to know each other through a process that was one of the most extraordinary things I've ever been through. Pamela, you lead this organization, Parachute Canada, which is a merger of, I believe it was 5 different injury prevention organizations that came together and thought we could do a better job doing this together. And this whole merger process was an extraordinary and complex adventure, which was led by our friend, Rem Langan, who brought this all together in a way that I always thought to myself when watching him doing that, I could never, ever do that, what this guy is doing. And now it's an incredible organization. It's grown so much, and you're the president and CEO of it. So what a pleasure.
Thank you. Yes, it's a very interesting organization, and that process was, as you said, it was very interesting and well worth it for sure.
Yeah. Well, yes, and so we're going to hear much more about Parachute and your work there. Just for everybody here today, of course, we created Change for Good, I think it was the beginning of April, as a way of bringing people together who are social change, in the social change space, by sharing what people like you, Pamela, are doing in this area, sharing ideas, giving people inspiration, creating a sense of community, and ultimately giving people, of course, we don't know what building back better is going to look like, but and there's no real answer, but to give people a flavor of what folks like you are starting to see, And also just wanted to remind everybody that if Pamela and I are having this conversation, but I encourage everyone here to ask questions, anything you think of for Pamela, we'll do our best to get to them. And it's an important part of this whole conversation, not just you and I. So just to start with, Pamela, I always am curious. I'm sitting here at home, you're sitting there at home. And what's life like for you now, living, after however many weeks of living and working at home? And give us a kind of flavor of what your life is like and how it's changed.
Sure. Yeah, I think we're at 100 days or something of working from home. I mean, for personally, it's actually meant way less time on the road commuting. So when I was not working virtually, I used to spend about 2.5 hours a day commuting to and from the office. So that's a huge change. I've realized I need a proper desk and a chair instead of sitting at the dining room table as a stopgap. So, I enjoy working remotely. I enjoy having 2 extra hours in my day for sure, but I really do miss seeing and interacting with my team. So it's meant, we've had to have, some different interactions than we would normally when we used to see each other in the office. We already had a partial work from home set up, so people were allowed, we worked virtually part of the week, but I really do miss seeing the team and having those, just informal or chats in the kitchen that ideas come up that don't now. It's much more formally, you have to have that opportunity to have a conversation either by Zoom or on the phone.
Yeah, interesting. It's good, but not quite good enough. I think.
Yeah.
Well, actually, I have to say that for the first time in the 100 days, I guess, our impact team will be seeing each other in person in my backyard today, having drinks at 5 o'clock. So everybody's invited.
I'm sure that will be a lot of fun.
Yeah. So anyway, I was talking about Parachute a little bit a few minutes ago. But for people who aren't familiar with Parachute, it'd be great if you could just share, what this organization, who you are, what you do, why it's so important.
Sure. So as you said in the introduction, Parachute is a national injury prevention charity. And really, we think about it as we have a social purpose. Our goal is for Canadians to live long lives to the fullest. And we know that one of the leading causes of death and serious injury are preventable injuries. And so that's what our organization focuses on. So we want people to engage in life, do all of the things that they love to do, and we want them to continue to do that by preventing serious injury and those kinds of injuries that cause death. So what does that include? Lots of people ask me what that includes. So it means focusing on the leading causes, which are, and won't come as any surprise to folks, road safety. So issues like distracted driving, speeding, impaired driving. We use the framework of Vision Zero, which people may be familiar with. It's been rolled out across the country as well as internationally. Falls is another big issue, and it may come as a surprise to some people that it's actually a leading cause of why many Canadians, especially those who are senior in 65 plus and young children, are hospitalized. We also focus on issues like concussion and poisonings, which we found out are a much bigger issue than we previously thought they were by looking at some of the various data sources and linking them together to see the whole picture. So really what we do is function. I describe it as a bridge between research, what's proven to be effective in addressing these issues, and action. So what can be done to prevent injuries? And we actually know quite a lot about how to prevent injuries. So the focus is really on that action, that implementation piece. Really, you may have heard the term knowledge translation. That's sort of a broad term around what Parachute does as a whole, but it means that we turn information into programming for communities to activate. We publish foundational documents in order to guide those working in those communities and those making decisions or policies so that they're based in what we know actually works. We have a finite amount of resources, and we want to make sure that what we're spending our time and money on is actually working. We do a lot of awareness raising. So we are very active on social media and with traditional media, but we've had a couple of high profile awareness raising campaigns recently that have focused on impaired driving, cannabis use in youth, and concussion. So that's a little, it's an overview.
No, thank you. Thank you for sharing that. And now, as you've said that, and what was going through my mind is the connection between injury prevention and where we are today with COVID. And it strikes me that there obviously are, as you talked about all those things, many connections. Of course, prevention would be fundamental in COVID, but also it seems like it must be that many of the things you just described, there's an influence here. And you and I actually had a chance to talk about this last week. There are many more people riding bicycles. There are more injuries there. Possibly fewer people driving cars. Is that contributing to reducing that? There's maybe concussion, or is that gone down because there are fewer people playing sports? I don't know. But tell us what your your thoughts are about why what Parachute does is so important today.
Well, I think that you've hit on an interesting concept around prevention and the intersection between a number of issues that people are talking about today. So certainly public health has become very much in the forefront of Canadians and internationally. We are a public health agency. That's the work that we do. Public health works to prevent disease, injuries, and working upstream, if you will. And so what we've seen through what's happened since the pandemic and since people have been in isolation, self-isolation or quarantine is that it has impacted certain groups of people. So our Canadian seniors certainly we've seen, the social isolation is a big issue that we've heard mental health professionals talk about, public health professionals talk about, but it's also a factor in falls. It's a risk factor. So people who are socially isolated have increasing mental health issues, as well as what we typically think about as, maintaining their physical strength and exercise. So, over the last few months, we've been looking at the issue of nobody wants to go to hospital right now unless they absolutely have to. We want to prevent one of the leading causes of hospitalization, and especially with our seniors. And so we've been reaching out to caregivers, to the seniors themselves with information and links to resources and through social media messaging, looking at how do we send the message, how do we get the information into the hands of people who need it most, and affect the health and wellness of seniors so that they aren't losing their physical strength and balance that they may have had before. They're not moving around as much. We don't want them to go to hospital because we know that that's often a precipitating factor in the journey to a long-term care facility, and nobody has ever said that was their plan, to move to a long-term care facility. And so if we work upstream, if we work to make sure that seniors are healthy, are safe, they can live independently as long as possible, and that aligns with that mission of Canadians living long lives to the fullest. We want them to be able to enjoy life, and where can we intervene in terms of policy making, in terms of information to seniors and their families. So that's one area that we've been working on. And you mentioned road safety. That's definitely something that we've seen to the forefront. Lots of people wanting to cycle and walk, not only for transportation, but for recreation purposes. And that's a good thing. We want people to be out and active. But there are vulnerable road users. You still hear, even with the decrease of cars on our roadways, you're still hearing about pedestrians and cyclists being hit and seriously injured or killed. So it presents a number of safety issues, but it also presents real opportunity for change. And so things like protected bike lanes that would keep people safe while they are cycling, but also encourage more people to cycle. It sort of touches across a number of sectors. Us as injury prevention professionals, we want those bike lanes because we know that it makes the environment safer. But organizations working in environmental change or climate change or physical activity, they're all calling for the same thing. So we're starting at different points, but we want the same thing in the end. So really looking at these points of intersection, how can we help support each other's agendas, more voices calling for the similar things. And so we want to see this type of collective action where we've actually seen it start internationally. We're part of a group internationally that's working on that. So, I think those are some of the things that, issues that have come up that have been an opportunity, that we've seen, that interconnectedness. People are so aware and conscious of, the different areas of their life that are now impacting each other. So, prevention is a concept, as you said, that's being addressed not only in health, but we hear the folks in the economic sector talking about it, the environment. And so how can we help and support each other as we go forward?
One of the things that I feel like central to what you just said is collaboration.
Absolutely.
Between sectors, and it feels like Parachute is in the middle of a kind of ecosystem. You talked about policy, we've seen the government obviously step back into this here in Canada and around the world in terms of throwing money and creating programs moving, and then the business sector, and then nonprofit organizations, so on. So organization like Parachute sounds like it's kind of in the middle of all this. And collaboration is all, like, to me, when I think about collaboration, I think it all sounds really good, also slow, and getting in the best of times, collaboration could be a slow process because you want to get everyone involved. But we need fast action now, and look at the situation with homes for seniors and so on, long-term care facilities. So how are you dealing, how is your organization responding to the need for speed?
Well, I think the identification of these opportunities, I think we've seen a huge speed, and this is typically what happens in my experience, is that the solutions or the actions that we have been calling for, asking, or trying to influence, you wait for the open windows, of opportunity, and you move quickly at that point. Certainly, you push forward regardless, but I think we've seen a huge, if anyone ever, believes that something can't be done quickly, if we look at what's happened over the past 3 months in terms of people making a choice, a decision of the point where we want to get to, how do we need to get there? Let's put this in place. So I think when there is the will, that you can see that this can happen very quickly. And so we are looking at ways and windows of opportunity that we may have been calling on for quite a long time, but we now have people interested, paying attention, and wanting to actually take action, and we're positioned well to be able to facilitate that as soon as possible.
That's really good. And the other thing that makes me think of is, like you were doing, I was obviously always important, but now it feels like perhaps what Parachute is doing is even more important than ever. Given you had all the same things that you were addressing before, but now it's kind of amped up because the context is different, as you just said. So, like, are people pouring money into Parachute now? Is that like to say, okay, like this, you are the organization in Canada that addresses all these issues. What does your funding situation look like? Is it, are people calling you more? What are you doing differently? And what does that look like?
Yeah. Oh, I wish they were pouring money into it. There certainly is new money, or more opportunities that we have been able to apply for. They certainly aren't pouring money into it, but there are some new opportunities. As a charity, we're always looking for sustainable funding, which is it's a huge challenge. There's few there's few sustainable sources of funding over long term. So much of our work is project-based funding, and that tends to be, between 1 and 3 years of funding, sometimes less. You mentioned we were a merger and amalgamation. I think we've proactively addressed the issue of too many charities working in the space of injury prevention. So right now, I mean, we're coping, but there's an aspect of timing in these kinds of situations. Maybe a year ago we wouldn't have been coping as well than we are right now. But in my experience, I think the true impact of this pandemic on funding is going to be felt next year, and certainly in the years after that. So we've taken advantage of all the subsidies that we've qualified for. But I think that the things that we're doing sort of twofold, really looking at those opportunities, being agile, flexible. My team is nothing if not nimble. So there have been windows that have been opened because of the current environment. So, opportunities to apply for some of the emergency funding that's been provided, by the federal government and distributed through places like the United Way and Canada Red Cross and that. So we definitely are making sure that we are applying for things that would support work that we want to do that is in line with our mandate. I think that's really important, that we are staying true to our mandate, but there's now an appetite for some of the things that we've wanted to do. And so we're moving on those opportunities. We started this before the pandemic began, but certainly making sure that we carve out time to look at some of the more sustainable revenue streams. So we've been looking at opportunities around social enterprise. What skill sets do we have that might fit with a social enterprise, or where are the needs or gaps that we might be able to do that? So this has given us a bit of a boost in terms of being able to look in that direction as well.
Can you share something that, if you could think of, like, this is a great example of either perhaps it's a nonprofit organization, you're working with a community group or a corporation, who in your mind is doing this really, really well? Like, what is that example that we could all learn from, or what's inspiring to you? You think about
it. I think that the collaboration, I think in the social sector with some of the key corporations. So I was been reading a lot, which has been another plus for this type of situation. I've been able to take advantage of some of these webinars and being able to read more about it. But I think that there's more of an appetite to look at a spectrum versus, the nonprofit, for-profit, public-private partnerships. I really have trouble with the nonprofit language. It's a definition of what you don't do versus what you do. But
I love it.
there's and I don't know that we're a social profit. I don't know what the term is. Social profit, I don't think is quite right either. But certainly it's for a social good. But I see that I don't know that there's any one example that for me stands out. But I'm so interested in the conversations that are happening right now around, what is the role of business in society and in doing good while doing well, and why are the tools that are acceptable for somebody in a for-profit, private sector business, frowned upon on charities or not-for-profits, that could actually do good with some of that. So, the spending around, we talk about overhead and, the fact that, everything is embedded in the work that an organization does. You take any piece of that away and you can't do that well. And so I think for me, I'm excited about those conversations that are happening between for-profit, not-for-profit, government around, what are the key expertise and skills and assets that we can bring to an issue and how do we all contribute to making that better? And I would love to see more of that happening. And I think the pandemic, COVID-19 has meant that many of those have had to come together very quickly. So, the provision of PPE, that may be a good example of, how do we turn people who are, making cider or wine, and they're now making hand sanitizers, or clothing stores or that are now making masks. So those are some real examples of how people can be innovative in the face of a challenging situation. But it also, I think, demonstrates how we all have those skill sets. If we bring them to a particular issue, how much better it is, and the outcome if we all work together. As you said, that collaboration sometimes takes time, sometimes it doesn't. Sometimes we just need to kind of throw off that red tape and just get to the solution.
Well, I love that. I personally have a bit of a patience problem, so waiting is not my favorite thing, but it's so exciting to see all this happening fast. And I also, you know so much about policy making and government and so on. I don't really, and but I've been thinking about it a lot in this context, and so it strikes me that on the one hand you've got government who stepped into, call it social change in this related to COVID very, very quickly, and also corporations and others have stepped into the emergency response of this, and just starting to think about the future a little bit more. One of the questions that I have is, the government spent such a long time actually kind of, downloading responsibility in some cases to the private sector, and I think hoping that the private sector will do more and they won't have to do as much. So now we're seeing the government doing more. So where's the question here? The question is, do you think that, is there a danger possibly that the corporate sector may say, well, now the government's more involved in this, we don't have to do as much?
Yeah, absolutely. I think that the conversation about who's responsible, not only levels of government, but different sectors, and where should the responsibility lie? I know a lot of folks that I talk to, think the work of injury prevention needs to be done by government, and others that are on the other opposite end of the spectrum that think it's an individual responsibility. I think it's usually somewhere in the middle. But I think if we approach it with more questions than answers around where does this make the most sense? Who has the legal jurisdiction, and does that need to change? What are we looking forward to in terms of government involvement? And certainly there is value in that, maybe in terms of setting standards and things like that. But then I think about the innovation and the magnitude of assets that corporations can bring to certain issues. And as you say, the patience factor can sometimes implement way faster than governments can. Where do we find that sweet spot, if we can, around how do we move forward doing what's evidence-based or what's effective, but we do it much quicker, and be able to evaluate. I think there's a concern with the recommendations coming out of government over the last 3 months. The masks are a good example of don't use them, yes, use them, now mandatory, use them. But it follows a very what I would say is that it's similar to any kind of healthcare treatment. You would expect, if they find new evidence for something that's effective, that when you go to the hospital or you go to a doctor, what they are actually recommending or the treatment that you're getting is based on that new knowledge. That because it's in a shortened time frame, it feels like they're just changing their mind every
Right.
couple of weeks. But really, it's as they get more information, they make more recommendations. So I think that there's a process to a circle back process that needs to happen of, try something out. If it works, great. And going back to that sustainability question, but if it does work, sustain it. Don't invest for 3 years, get it to a point where it works really well, and then say, okay, now you have to find out how to sustain this, but it does work well. So I think that there's some lessons to be learned there.
So I have a question. We're almost out of time, but what you just said made me think of one question, which is around your organization, your sustainability, make it more sustainable, have more impact. So when you think about, the future, whatever that may be, whether that's next week or next year, what is one thing that, if you've thought about it and your team has thought about it, the Parachute will not be doing anymore? And what is one thing that Parachute is going to be doing differently?
So maybe I'll start with the the second one. What will you do differently? I think that this has allowed us to really test out a couple of different functions for ourselves. So we've been doing some of similar to this conversation panels, making sure that we get people's voices out across the country to people who are working in the area and connecting people. We do a really good job of that. We have done a very good job of that, and I think we've found different ways to do that now and going forward. In terms of something that we won't do, that's interesting. I think from a logistical perspective, I think that working virtually is here to stay. So I think that there will be a change to how we do our work, or how we do our work together, and that I think is going to take some thinking in terms of how do we continue to have a strong team and support their creativity, but do it as a team. And how do you do that when you're not always in the same place face to face? Because we know how to do that. We don't necessarily know how to do it virtually. So I can't think of something specifically that we won't do anymore. But I think it's more about how we're changing, or the word of the day, pivoting, to do things slightly differently because of what we've been able to learn throughout this process.
Thank you. We're out of time. Every time these conversations, it's the hardest part is stopping because you're just getting into it. But I've always learned something from you, and I know that everyone else here will feel the same way. And I really appreciate you being here, Pamela. I appreciate the time. Appreciate everything your team at Parachute is doing in general in the context of today. And people should check out, is the website parachute.ca?
It is, yes.
Parachute.ca, so check that out. Everyone should check it out. I'm sure there's a way, if you go there, to find a way of supporting it. I also want to thank everyone at Impact, our great team, who are going to be here in my backyard this afternoon. So I'm really psyched about that. Also wanted to say that everyone here and everyone part of our Change for Good community will receive a link to a recording of the conversation that Pamela and I have had today, and also a link to be able to register for next week's conversation, which is on June 25th. And I'm so excited about that. Speaking with someone I've never met, named Jen Harper, who is the founder and CEO of an organization called Cheekbone Beauty Cosmetics. Okay. And when I had a chance to speak a number of weeks ago to Tabitha Bull, who's the CEO of the Canadian Council for Aboriginal Business, she was so excited about Jen's work, and so am I, and I'm looking forward to sharing that with everyone. So I really appreciate everyone's time. Appreciate Pamela, appreciate your time. Look forward to seeing you all next week.
Thanks so much, Paul.
Take care.
Take
You're
care.
welcome. Take care.
Bye-bye.
Bye.